I think patients like our virtual visits because of some of the convenience that it offers. For example, if someone's working from home, they can take a break, get a quick visit in, get their refills or whatever's appropriate, and then move on with their day. It also can allow parents to have their kids be seen without having to get them all ready to go, drag them in, wait in the waiting room, and some of the frustration that can happen with that. It allows for a more efficient delivery of care in some places, in some instances. And we also are sometimes able to see things if we're able to talk to them in the home that we may not be able to pick up when we're seeing them in the clinic. And that has been useful for some providers as they've done these virtual visits. But basically, I think the convenience and especially now not having to potentially expose themselves to coronavirus and where people may be sick, there's a lot of people who are scared but still need medical care, and the virtual visits offer an opportunity to provide that. Well, right now, the way that we maintain a personal connection with our patients through visits is one, we've already got that personal connection because we've already seen them in the office in most cases. Also, we have to wear masks right now. And so the virtual visit is actually a chance to have more of your face showing when you're talking to your patients, and you're able to see their face more completely as well, which is something that I'm missing more than I thought I would. That one-to-one connection, that ability to connect with someone, while it may be easier to do when you're physically near them, you still can do it through technology. You still can pick up on nonverbal cues. You can still get the gist of what they're saying and what they're not saying through facial expression. And so uh, the providers and patients that are willing to put themselves out there and do the visit in a wholesome and real manner, they can certainly get that one-on-one connection, and they can certainly uh, have that relationship continue to grow. So there's a few different types of appointments that I think work well for virtual visits. I think that once someone is well established on a medication, for example, perhaps anti-anxiety or antidepressant medications or attention deficit hyperactivity medications, as long as they're coming in so we can still monitor the things we need to monitor physically and through labs, et cetera, doing their physicals, we can do some of the visits in between virtually very easily. And it's a good way to see how they're doing in their own environment as opposed to the somewhat artificial environment of the office. Other visits that can be done virtually, some upper respiratory infections, routine allergy visits, UTIs or urinary tract infections, if someone has pink eye or some kind of a relatively straightforward complaint, a lot of times we can talk through that. And if we're able to see the patient, we're able to make a quality evaluation and assess what we need to, what we would recommend and appropriately treat them. I would tell people who are considering a virtual visit to give it a try. You may end up having to wait on in the waiting room virtually for a few minutes while that provider is getting from one thing into the other. But you're waiting in the comfort of your own home. I think especially if you have a previous relationship with a provider and you have a good rapport, you trust them, and they're able to communicate well with you, I think the virtual visits are a great way to augment how we are able to provide care to the people who put the faith in us to help take care of them and their families.